Hi everybody, this is Dr. Ortegon with San Antonio Cosmetic Surgery. Dr. Baumholtz and I have been early adopters of all the ThermiVa technologies and been using it for approximately 5 years, and been really excited to have provided dozens and dozens of patients skin tightening of the face and neck and arm. And for the last 18 months, we're really proud of having ThermiVa. ThermiVa is specifically designed for vaginal rejuvenation. It uses the same kind of energy that the other radiofrequency techniques that we uses, but with a special handpiece that's meant to be comfortable, painless, and affords us a really quick recovery. So we'll be starting a procedure today, and because of Facebook rules, we won't be showing any nudity, so you can rest assured, but I'll be trying to answer as many questions as we can as we go along. So I'm going to move into position over here.
Who is the best candidate for this type of procedure?
So any woman who feels like they are having either vaginal looseness, or if they're having some issue with the labial length, either the external labia or the internal, so the majora or the minora. So we're going to start by putting on just a little bit of lubrication there. It's warm. We typically want to use it warm because we don't want to shock anybody. It's a very comfortable procedure so that patients can get up, leave here, and be back to doing the things they want to do, even the same day, which include exercise and even sexual activity the same day.
Now, Cynthia is our lucky straw drawer
Okay.
from our office, Nurse Cynthia.
Okay. Hi everyone.
Hi, how are you feeling, Cynthia?
Fine.
So all we're doing is slowly getting the skin temperature up, and we're shooting for about 42 degrees centigrade in each area that we are treating, which includes the external majora, the minora, and around the clitoral hood. We typically will treat for about 3 to 5 minutes on each side. So now that things are a little warmer, we're able to work. And so this is, without being able to see, this is a really pretty boring procedure because there's not a whole lot of action here to do. It's really comfortable, so most patients don't complain. You don't need any special preparation. So as long as a patient has had a recent pap smear and gynecologic exam, really within the last 2 years, should be more than appropriate. Now, patients who have a history of either genital herpes is an issue, and all we have to do is pre-treat with acyclovir, and becomes a non-issue at that point.
Does it matter if they've had a hysterectomy or endometriosis?
It does not matter if you've had a hysterectomy. This is really beneficial to a lot of women who have had a hysterectomy because we can treat the symptoms, especially in patients who have lost an ovary. So if they've taken the ovaries and given essentially a surgical menopause, we can treat the effects of that by using ThermiVa. So we can actually help with vaginal moisture, it can help with clitoral sensitivity, and also with size.
Is it both internal and external?
Great question. I'm concentrating. Yes, we do treat the external vagina, so we treat the labia majora and the minora, and then when that is complete, then we spend about 3 to 5 minutes on each zone of the vaginal canal. So we treat the right and left sides, and then the superior portion, and also the rectal side. That has proven to have a lot of benefit to a lot of our patients because patients will say that they have improvement in stress urinary incontinence. So a lot of women after childbirth will leak a small amount when they sneeze, and it's something no one ever wants to talk about, but it is a fact of life for very many women. And many of our patients, after even the first treatment, say that they symptomatically have less of that.
Awesome. Does this heighten any sexual activity?
Well, it won't change your sexual activity. It may change your sexual response. So we have had patients who have difficulty in reaching an orgasm, who have more success in being able to reach that in either a shorter time, or for women who have been anorgasmic, there have been literature reports that those patients are able to have orgasm after having completed this cycle.
We have questions from the audience. They want to know if you can have this treatment if you're breastfeeding.
You absolutely can have this treatment because it does not involve any drugs. We use a sterile lubricant, and then no drugs at all. So yes, you can have this and still continue to breastfeed.
And how long does this procedure normally take?
Normally about 15 to 20 minutes, and then patients are often doing the things they want to do.
So Cynthia's going to actually go back to running clinic today.
That's right.
Back to work,
Back
no
to work.
rest.
No rest.
What does it feel like, Cynthia?
No pressure at all, no discomfort, nothing. I basically just feel the gel. That's about it.
So just
No
warmth.
pain, just warm, nothing else, actually.
And this is your first treatment?
Yes, it is, first treatment. And I've had 2 children, so I'm not uncomfortable at all, really.
Any other questions in there today?
No.
So this process will take a little while. We'll be glad to answer questions as they come in, and I will be around for quite a while to make sure that everybody gets their questions answered. Make sure to put them in comments on Facebook. If you have questions and you don't want to send them on Facebook, we'll be glad to answer phone calls. So make sure to call us at our office number, 210-614-4320. Just give us a call. We'll be glad to answer your questions.
They do have one last question.
Oh, sure.
They want to know how many treatments, will you see some results within one treatment?
Sure. So we recommend doing 3 treatments for most patients. And yes, we have had patients who see an immediate difference even after their first treatment. We would still recommend that patients finish their treatment protocols so that they have longer lasting results.
And how often in between? What's the length of
So
time in
the
between
typical treatment schedule is going to be 1 treatment about every 30 days times 3 treatments.
Okay. Alrighty, we will be posting, right, Cynthia?
Yes, we will, so don't forget to like us on Facebook. Make sure, again, if you have any questions, we'll be around to answer all day. We're here till 5. If not tomorrow, if you want to do a consultation, definitely come on in. We'll see you for that. Not a problem.
You can see that there's absolutely no pain involved,
Not at
just
all.
gentle warmness. And we'll be posting the before and after pictures. The link after this live stream is posted.
Bye, everyone.
Bye.
Bye.